is Tasha Bogle, and I'm going to be doing my injections. Okay, so I'm going to sanitize my hands. Okay, so I'm going to get my medications, and if my medication had a lid on it, I would flip it off, but because mine doesn't, I'm going to sanitize the top half of my medication vial before I get my needle. So I've done my drug calculations, and I'm going to be administering 1 milliliter of solution via IM. So I'm going to select my 3 millimeter syringe. I'm going to open my syringe, and then I'm going to take off my cap, and I'm going to pull 1 millimeter of air into my syringe. I'm then going to stick it into my vial, and then I'm going to insert that 1 millimeter of air so that it's easier to withdraw my medication. And I'm going to do it slowly so that I have less air bubbles. I'm going to go past the 1 millimeter mark so that I can take out any air bubbles. So I'm going to go to 1.1. I'm going to take out my syringe, and then I'm going to flick out any air bubbles. And I'm going to look around my syringe to make sure that all my air bubbles are out, and they are. And then I'm going to push it up to the 1 millimeter line. I am then going to recap my syringe using the one-handed technique. And I'm going to push it against the edge of my desk, and I'm ready to inject my solution via IM. So now I'm going to show you the landmarking sites for IM. So my first one I'm going to do is the deltoid muscle. So I'm going to place my non-dominant hand. I'm going to place my index finger on the anterior acromion process, and then I'm going to place my middle finger towards the posterior acromion process, and then I would inject in between that V, which would be the deltoid muscle. My next landmarking would be my ventral gluteal. So I am going to find her greater trochanter muscle, which is right here, and I am going to put my palm on that greater trochanter muscle. I'm going to have my index finger on the median line of her lateral side, and I'm going to have the rest of my fingers pointing towards her in posterior glute. And then once again, in that deep V, I would place my injection. The next location that I would place my injection is the vastus lataris, and I'm going to find that greater trochanter, which is right here, and then I'm going to do it 1 palm width below the greater trochanter, so here, and then my other palm is going to find her patella, and it's going to be 1 hand above her patella, and then in that middle third of her thigh, I am going to place my injection right here. So it's between her median lateral and her median anterior line in that thigh muscle. So now I am going to do my injections. So I'm going to put on some gloves. And then I'm going to sanitize my area. And I'm going to do it in a 5 millimeter circle at my injection site. I am then going to uncap my syringe with my non-dominant hand. And then I'm going to Z-track on my muscle thing here. So I'm going to Z-track and pull the skin back. And I'm then going to inject my needle at a 90-degree angle for intramuscular. Okay, and then I'm going to hold it with my non-dominant hand that's Z-tracking. And I'm going to aspirate for any blood. If there was blood, I would take out my syringe and I would start all over again for my medication. But because there's no blood, I am okay to inject my medication. I'm going to do it slowly for 10 seconds. Okay, and then I'm going to leave it there so that the medication is absorbed into the muscle. I am then going to remove my syringe from the injection site, and I'm going to let go of my Z-track, and I would get an alcohol swab and I would massage the muscle. I'm then going to take my cap and my syringe and I would throw it into the sharps container. And then now I'm going to show you guys how to do subcutaneous injections. Okay, so for sub-Q, I'm once again going to sanitize my hands. And then I've already done my dosing calculations, so I know that I have to do, once again, another millimeter of medications. So for this one, I'm going to take the 1 millimeter TB syringe for my subcutaneous. I'm going to remove my cap with my non-dominant hand. I'm going to take out 1 millimeter of air and inject that into my vial. I'm going to slowly retract the syringe so that it limits the amount of air bubbles that I will have. I'm gonna go a little past the 1 millimeter mark for any air bubbles. I'm gonna take out my syringe and I'm gonna flick my syringe so that it gets out any air bubbles. I'm then going to push to the 1 millimeter line. And then I'm going to once again recap using the one-handed method. And now I am ready to go locate my patient. Okay, so for subcutaneous, the first location is the back of the arm in that subcutaneous tissue. So it would be right here in the back of the arm. The next one would be in your abdomen. It would be in between the costial margin and the iliac crest. Making sure that you avoid the 5 centimeter border around the umbilicus. And then your third one would be on your thigh, and it would be once again in that subcutaneous muscle. I mean, not muscle, but subcutaneous tissue. So now I'm going to inject my solution. I'm going to apply some gloves. once again alcohol swab and sanitize my area that I'm going to be injecting in a circular motion. And because I'm doing a sub-Q, I don't need to aspirate my syringe. I'm going to take it off with my non-dominant hand. And I'm going to go anywhere between a 45 and a 90-degree angle. If my patient was obese, I would go to a 90-degree angle. And I'm going to bunch this in, and then I'm going to inject at a 90-degree angle with my bezel up. And because it is a subcutaneous one, I don't have to massage the tissues after. And I'm going to throw my solution in the sharps container again. And then I'm gonna go document, and I've done my injection sites.